Who could forget those disturbing months in India in early 2021? Hospitals at capacity, an acute oxygen shortage, and the health infrastructure almost at breaking point. India was hit hard with the COVID pandemic, but a resilient population battled on. As a result of the economic downturn in the wake of the pandemic, many were unable to bear the upfront costs of healthcare and treatment resulting from unforeseen medical emergencies. Many were left searching for other alternatives to cover their needs. This is when the importance of holistic health insurance coverage was realized. The health insurance sector was seeing steady year-on-year growth. However, the COVID pandemic gave it a boost, which increased the sector's growth exponentially. The Confederation of Indian Industry estimates that the health sector in India has the potential to grow at an annual rate of 30 to 35%.
The contributions of the insurance industry are also noteworthy during these difficult times. They were able to provide timely financial assistance to the family of about 27 lakh, and about 24,000 crores of claims were paid with a remarkable speed, thus providing the support that was required at that point of time.
India's health insurance sector has been growing with 3 A's: awareness, accessibility, and affordability. In India, there are 6 standalone health insurance companies, and there are 19 third-party administrators to facilitate seamless reimbursements. In order to reach people in rural areas and for the urban poor, the government launched Ayushman Bharat Pradhan Mantri Arogya Yojana, AB-PMJAY, the largest subsidized scheme covering 40% of India's population at the bottom of the pyramid. Since its launch in 2018, the PMJAY scheme has involved 35.6 million hospitalizations and has disbursed $5.17 billion USD. Nearly 70% of the country's population is now estimated to be protected by some health insurance coverage, including the state government scheme, social insurance schemes, and private insurance.
Health insurance numbers are increasing year on year, but what pandemic has done is that it has increased the awareness to a great extent. Now everyone is looking at vaccination, everyone is looking at variety of preventive measures, etc., and that has resulted into increased awareness about insurance. And we hope in future that lot of families will get their cover and come under insurance fold.
With a vision to ensure the health of 1 billion Indians by 2025, the Confederation of Indian Industry organized the 16th Health Insurance Summit 2022. The summit focused on democratized access to quality and affordable healthcare for all by placing the patient at the center of the care continuum. The outbreak of the pandemic has given a new push to the insurance sector in India, where public-private partnerships play a pivotal role.
Largely, universal health coverage can happen only through a public-private partnership. So, it's all whatever wealth we have in the form of knowledge or a hospital infrastructure or industry, it's all part of government. So naturally, there should be a public-private partnership to see that how we can make every household have a health insurance policy.
According to health experts, all Indians should have health insurance by 2047, when India marks 100 years of its independence. The country has already initiated a slew of amendments and policy changes that will help the country reach this goal. These changes will help to create an ecosystem wherein healthcare startups will thrive. The pandemic has given all of us pause to rethink our health, both physical and mental. Policymakers in India realize that the anxiety of high hospital bills is something that Indians can do without to increase productivity. Therefore, this fresh thrust to make healthcare accessible for all is another initiative that India is prioritizing to make a quantum leap in its growth trajectory.